Hello friends, welcome to SkyG classes. Today we are going to discuss about the first professional MBBS examination of 2021 biochemistry paper 1. So this is a long essay question asked in the exam. So the question is 23-year-old female was brought to the casualty with the complaints of dizziness, weakness, and fainting attack. History revealed that she had skipped her breakfast and lunch with intention of losing weight. Random blood glucose was 40 milligram per deciliter. All other investigations are normal. So the first question is, what is the probable diagnosis? So what is the probable diagnosis? It's of 1 mark. The second question is, what is the normal blood glucose level? And third question is, describe the regulation of blood glucose. And fourth one is, add a note on glucose tolerance test. So let's move on to the first question. What is the probable diagnosis? Of course, she has skipped her breakfast, so it will be hypoglycemia. Her glucose concentration has decreased, so it is hypoglycemia. Glucose concentration in blood has decreased, so it is hypoglycemia. So let's move on to the that is the 1 mark question. Okay, hypo means decreased, less concentration in the blood. Okay, so let's move on to the second question. That is, what is the normal blood glucose level? So I guess everyone knows that the normal blood glucose level is 70 to 110 mg per dl in the fasting state. Okay, so that is also 1 mark question. So easy. So let's move on to the third question. So this is one of the key question in the exam because it is a long essay question having 15 marks. So this one carries the chunk because it carries 8 marks. Okay. So what is the describe the regulation of blood glucose? So regulation of blood glucose. Let's have a deep knowledge about that. So what are the factors affecting blood sugar? So first we have to know what are the factors affecting the blood sugar. You know, the blood glucose is actually determined by what are the input for the blood glucose level. First one is the diet. Whatever dietary food we are consuming, that is contributing to the increased blood glucose value. The second one is the glycogen stored. So the glycogen stored in the liver. And third one is the gluconeogenesis. Gluconeogenesis, you know what is gluconeogenesis? It is the glucose formed from any other non-carbohydrate sources. So it can be from any other non-carbohydrate sources. So these are the three ways in which the blood glucose is increased in the blood glucose is increased. So then what are the ways in which the blood glucose are decreased? Like through oxidation. If the glucose is undergoing oxidation, that is glucose is 1 molecule of glucose is converted into 2 molecules of pyruvic acid. That is what you mean by oxidation. That is partial oxidation, which is known as anaerobic glycolysis. Okay, then so in that way the glucose concentration is decreased in the blood. The second way is the glucose is converted into glycogen. You know, glycogen is the polymer of glucose. So glucose is converted into glycogen. Then the third way is glucose is converted into fat. Okay, the third way is glucose is converted into fat. So these are the three ways by which the glucose can be decreased in the blood. Okay. So we have discussed about the factors affecting the blood glucose. Now coming to the hormonal regulation of blood glucose. So what are the hormones which are regulating the blood glucose level? So first you can see the hypoglycemic hormone. The only hypoglycemic hormone is insulin. Okay, so there are many hyperglycemic hormones, but only hypoglycemic hormone which will decrease the blood glucose concentration is insulin. So what insulin do? It will decrease the blood glucose concentration. So that's why it is known as hypoglycemic hormone. So whenever the glucose level in the blood is increased, what happened? It will be decreased. The insulin secretion will be increased. Whenever there is increase in the blood glucose concentration, insulin will be secreted by the beta cells of the islets of Langerhans from the pancreas. And what happens? It will decrease the blood glucose concentration. So hence it is known as hypoglycemic hormone. Coming to the hyperglycemic hormones. Okay. So what are the hyperglycemic hormones? Glucagon, cortisol, adrenaline. Okay. And you can also add thyroxine also. Okay. So these are the hyperglycemic hormones which will increase the blood glucose concentration. Okay. Thyroxine. Okay. From the thyroid hormone can increase the glucose concentration. Then let us move on to, so this is all about the hormonal regulation. Coming to the effect of food on blood glucose level. So in the regulation of blood glucose, we have discussed what are the factors affecting the blood glucose. Second, we have discussed about the hormonal regulation of blood glucose. Coming to the effect of food on blood glucose level. So there is two types of regulation. First one is the regulation postprandial state. Second one is the regulation fasting state. So what do you mean by fasting state? So what do you mean by postprandial state? After the food intake, right? So there is a regulation in the postprandial state as well as there is a regulation in the fasting state, that is without the intake of food. Okay. Without intake of food. Okay, so this is the effect of food on the blood glucose level. Then let us discuss in detail how the regulation occur in the postprandial state. Okay. So in the postprandial state, that means we are intaking food, right? So the food is going, what happens? The glucose level, we are consuming glucose, right? So what happened? The glucose is absorbed. Okay, the glucose is absorbed into our body. So the blood glucose absorbed into the blood. So what happens is the blood glucose level will increase. What happens if the blood glucose level increases? The insulin will be secreted from the beta cells of the islets of Langerhans. So what happens? The insulin secreted. Then what does the insulin do? It is a hypoglycemic hormone. It will decrease the blood glucose concentration. So what it will do is, it will try to decrease the blood glucose concentration. How the glucose level can be decreased? Think how can the glucose level be decreased? In the first slide, we have discussed that the glucose concentration can be decreased by some ways, right? So the first one is glycogenesis. That is, the glucose is converted into glycogen. So that glycogenesis means glycogen formation, right? So the glucose is converted into glycogen. Second way is glycolysis. Like what is glycolysis? Glucose is converted into pyruvic acid. It is the oxidation, right? Glycolysis. Third one is lipogenesis. What is lipogenesis? Glucose is converted into fat. So the increased glucose can be decreased by these three ways. One way is by converting into glycogen. Second way is by converting the glucose into pyruvic acid. Third way is by converting the glucose into fat. Okay, so finally blood glucose level is decreased. This is only the postprandial regulation. Okay, this chart is enough when you are writing about postprandial regulation. So you can see in this diagram, it is clearly taken from the Vasudevan, DM Vasudevan sir's textbook. So it is clearly mentioned that the blood glucose regulation during postprandial state, what happened? There will be high insulin level, right? So you can see red arrow indicates the activation and the blue arrow indicate inhibition. So you can see that the glucose will be converted into glycogen synthesis, and that takes place in the liver. Second one, what happens? The glucose will be converted into fat. So what happens? Lipogenesis, that takes place in the adipose tissue. And what is the third step? The third step is, the glucose is absorbed from the intestine. Okay. So then the gluconeogenesis and the lipolysis are inhibited in the regulation during the postprandial state. So you just draw this diagram also, include this one also in your answer paper so that it will look more colorful and attractive for the examiners. So coming to the next regulation. So this is all about the regulation in postprandial state. Coming to the regulation in fasting state. So what do you mean by the regulation in fasting state? We are not intaking any food, right? So after a meal, glucose level increases and then decreases, right? So we are talking about we are intaking a meal. So what happens? Glucose level increases. Then after some times, with the passage of time, what happens? The glucose level will decreases and it reaches a fasting level and fasting level by 2 to 3 hours. So that is actually meant by regulation in fasting state. What is postprandial state? It is the regulation just after the intake of food. Okay, post means after. So postprandial means just after the intake of food. But here what happens is we are intaking a meal. That time glucose level increases, but after some time, so it decreases and it reaches a fasting level by 2 to 3 hours. So it can decrease even further. Okay, so we have to prevent that decrease because hypoglycemia is even more worse than hyperglycemia. Why? Because our brain needs constant supply of glucose for its functioning. So what happens is we cannot have a decrease in the glucose level. So it can be prevented by factors which increases the blood sugar level. So how can we increase the glucose level? If the glucose is decreased, how can we increase the glucose level? First way is glycogenolysis. That is, glycogen is converted back to glucose, right? So the glucose level in the blood increases. Second way is gluconeogenesis. What is that? Glucose is produced from a non-carbohydrate source. In that way also the glucose level will increase in our blood. Third way is hyperglycemic hormones. We have discussed about the hyperglycemic hormones, glucagon, cortisol, thyroxine, etc. So these are the ways by which we can increase the blood glucose level. So this is the regulation in fasting state. So what is happening in this regulation in fasting state? It is the glucose level is low, so we have to increase the glucose level. So there are three mechanisms by which the glucose is increased. How? Glycogenolysis, gluconeogenesis, and hyperglycemic hormone action. Okay, so this is the regulation in fasting state. So let's look into a diagram in which it is clearly mentioned. You can see the blood glucose regulation during the fasting state. Okay, so it is having high glucagon. Glucagon is a hyperglycemic hormone. So high glucagon concentrations. You can see that the glycogenolysis is happening in the liver, so that the glucose concentration increases. Then the gluconeogenesis is happening in the muscle. The most common substrate for gluconeogenesis is the gluconeogenic amino acids, right? Alanine and all. It is present in the muscle, right? So what happens? The gluconeogenesis is taking place in the muscle. So the glucose is actually formed from non-carbohydrate sources like amino acids and all. The third mechanism is lipolysis. That is, the fat is also converting into glucose, right? So that is lipolysis is also activated. Red arrow indicates activation. What the blue arrow indicates? Inhibition. So lipogenesis is not taking place. Okay, so that is the regulation in fasting state. So simply it is nothing. When you are intaking food, that is postprandial state, what happens? The glucose level will be more. So our body will try to decrease the blood glucose concentration by the mechanisms I have described earlier. Similarly, when you are fasting, what happens? The glucose level is less. So our body will try to increase the blood glucose level by these mechanisms. Okay, I have discussed everything. So next, coming to the next question, that is, this is a 5-mark question. What is add a note on glucose tolerance test? So we commonly call glucose tolerance test as GTT. Okay, so let us talk about glucose tolerance test, GTT. So this is glucose tolerance. So what do you mean by glucose tolerance? Glucose tolerance means it is the ability of a person to metabolize a given load of glucose. If you are given a load of glucose if you are made to intake a load of glucose, how much you can metabolize. That is unique, like it is different for different persons. Okay, it's the ability of a person to metabolize a given load of glucose, that is the glucose tolerance. So we have to analyze this glucose tolerance for estimating whether the person is having diabetes mellitus, increased glucose concentration in blood or not. So we are doing this investigation. So we are doing oral glucose tolerance test. Okay. So what are the indications? That is when we will do this glucose tolerance test. First one is symptoms of diabetes mellitus, but FBS values are not diagnosed. What is FBS? Fast blood sugar value. What is the normal fasting blood sugar value? 70 to 110 mg per dl, right? So what symptoms of diabetes mellitus? So we are doing this oral glucose tolerance test in patients who have symptoms of diabetes mellitus, but the FBS values are not diagnostic. It is not it is normal, but there is some symptoms of diabetes mellitus. Second stage we are doing this test is during the pregnancy. That is, if there is any excess weight gain, excess weight gain, or past history of a big baby, or there is a past history of abortion. So these are the three conditions we are testing for oral glucose tolerance test in pregnancy. So these are the indications for oral GTT. Coming to the contraindications, that is when you cannot perform this test. If a patient is he's confirmed of diabetes mellitus, you cannot do this test. Second one is acutely ill patient, you cannot do this test because we are actually we are enabling them to intake a huge amount of glucose. So in a confirmed diabetes mellitus patient, of course that is going to produce some bad effect on that patient, right? And similarly in acutely ill patient. So contraindications, you cannot give this you cannot perform this test on these two patients. Okay, coming to the preparation. How can you, that is before this test is carrying out, you have to prepare the patient. That is, prior to the test for 3 days you should give the patient good carbohydrate diet. Okay, carbohydrate is rich in glucose, so you have to give good carbohydrate diet for 3 days prior to the test. That is the way we can prepare the patient for the oral glucose tolerance test. Okay, coming to the test, how can we perform this test? The first procedure is fasting blood and urine samples are collected. Okay, so we will collect the fasting blood and urine samples. Second step is 75 gram of anhydrous glucose in 250 ml water. Okay, this is the preparation that we are giving to the patient. The patient is made to intake 75 gram of anhydrous glucose in 250 ml of water. So 1.75 gram per kilogram of the body weight is actually the amount of glucose that you have to take. So here we are generalizing 75 gram anhydrous glucose in 250 ml water. Then you have the blood and urine samples collected at half hourly intervals for 2.5 hours. Okay, so we have to perform this test, that is blood and urine samples collected at half hourly intervals for 2.5 hours. Then blood sugar is estimated and the urine is also checked for sugar. This is the test. Simple test. First, fasting blood and urine samples are collected, and finally the procedure is carried out. Okay, so causes of abnormal GTT. What are the causes of abnormal GTT? Why you get abnormal GTT? First main cause, diabetes mellitus. Second, you can get abnormal GTT in impaired glucose tolerance. Third, impaired fasting glycemia. Fourth, renal glucosuria and elementary glucosuria. So these are the 5 causes of abnormal GTT. So this much you have to write in glucose tolerance test. Okay, so this is this is all about glucose tolerance test, and this is the question. Okay, so while writing long essays you have to manage your time perfectly. That is much important. So I'm winding up this session. Thank you everyone for your patient listening, and all the best for your exams. Make sure you subscribe SkyG classes for more updates. Please share this uh, video if you find it interesting. Like, subscribe, and support. Thank you.